Swim bladder disorder refers to a condition when the swim bladder does not function normally due to disease, physical abnormalities, mechanical/environmental factors, or for reasons that cannot be diagnosed. Affected fish will exhibit problems with buoyancy, that is, they'll have difficulty controlling their ability to float or sink. Sometimes a fish owner may think a fish floating abnormally in the tank is dead, but it is actually exhibiting symptoms of swim bladder disorder. Fish suffering from swim bladder disorder exhibit a variety of symptoms that primarily involve buoyancy. Causes of swim bladder: overeating, rapidly eating, gulping air, low water temperature, parasites or bacterial infections, occasionally a hard blow from striking an object in the tank. A fight or fall can damage swim bladder. Cysts in the kidneys, fatty deposits in the liver or egg binding in female fish can result in enlargement to affect the swim bladder. Treatment: let the fish fast for 3 days if there is an enlarged stomach or intestine. Fix the water temperature. Increase the water temp to 78 to 80 Fahrenheit and leave it there during treatment. Feed the fish peas. On 4th day feed fish cooked and skinned pea. Frozen peas can be microwaved or boiled for few seconds. Remove the skin and then serve the pea to fish. Peas should not be too soft but not too firm. You can feed a pea per day for few days and then switch to species-appropriate food. Antibiotics. If infection is the cause of a fish swim bladder disorder, treatment with broad-spectrum antibiotic may help. Other treatments include: add small amount of aquarium salt to the tank. Reduce the water level to make it easier for the fish to move around with it. Tetra, lifeguard, all-in-one treatment, attacks a broad range of disease-causing organisms: bacterial, fungal, viral, and parasitic. It is broad-spectrum non-antibiotic agent. Each pre-measured dose treats for disease-causing organisms associated with white spot, ick, red streaks, milky or shedding slime, mouth and fin rot, clamped or torn fins and ulcers. May be used as a preventive when adding new fish. Directions: remove filter carbon and turn off UV sterilizer. Add 1 tablet per day to each 5 gallons of aquarium water. Treat for 5 consecutive days at 24 hours intervals. For best results, after 5-day treatment, wait another 24 hours, day 6, before returning activated carbon and turning UV sterilizer. Also day 6 make a 25% water change using a tap water conditioner/dechlorinator, such as Tetra AquaSafe. How to prevent swim bladder disorder. Keep the tank clean and performing regular water changes. Keep the water temperature a bit higher will help digestion and possibly avoid constipation. Feed only high-quality foods and consider soaking dried foods for few minutes before feeding. For fish that gulp air when feeding at the surface, try switching to sinking foods. Avoid overfeeding. Feed smaller portions so fish can't overeat and watch total amount you feed throughout the week. Swim bladder disorder is not contagious from fish to fish. But it is best to move your ill fish to a separate tank where it can be treated and observed. The tank should be empty of gravel or plants so you can clearly see how the fish is doing. Use fresh water, and do not use water from the tank from which the fish came because the water could have caused the problem.